Doctor, is preimplantation genetic testing necessary in IVF?
Preimplantation genetic diagnosis started in late 1990s and early 2000, and KrishnaIVF clinic had their first preimplantation genetic baby in 2004 using the FISH technology. Preimplantation genetic testing for aneuploidy is a medical procedure that is performed during the in vitro fertilization to screen embryos for chromosome abnormalities. This involves testing a small sample of cells from an embryo to determine whether the embryo has the correct number of chromosomes, and preimplantation genetic diagnosis can help to identify embryos that have chromosomal abnormalities which are not suitable for transfer, and these can be discarded. Studies have shown that at one time it was thought PGD should be for everybody, but now as understanding is improving and as parallel technologies are coming in like time-lapse, preimplantation genetic diagnosis for aneuploidy is more useful for older women where the risk of aneuploidy is high, or when the woman has multiple failures. It's important for you to discuss the potential risks and benefits with preimplantation genetic providers. Sometimes the process of biopsy, the steps involved in the transport and the cryopreservation can have their own potential risks. So one should outweigh the risks and the benefits of doing a preimplantation genetic diagnosis, and you should do it when it is absolutely needed. It is important to know that preimplantation genetic testing is not recommended for all individuals undergoing IVF. The decision to undergo preimplantation genetic testing should be made after careful consideration and consultation with a good quality physician and a clinic. They can help you to understand the potential risks and benefits and determine whether it's a suitable option for you. Lot of times you see in the net, preimplantation genetic diagnosis is marketed as a magic solution. It is not a magic solution. It is used to deselect an embryo, and the pregnancy rates after preimplantation genetic diagnosis selected embryos are around 50 to 70% of the transferred embryos. So one should be careful to carefully read the data before they choose preimplantation genetic testing as a solution for them.